start. Okay, you're recording.
Okay, so we're just looking now at the muscles which actually move the ankle. And again, remember, tendons have to cross a joint in order to act upon that joint. So one important muscle here is the tibialis anterior muscle, which we know both dorsiflexes the ankle as well as inverts the ankle. So the tibialis anterior originates on the posterior or anterior tibia and interosseous membrane, and it comes down and it dives down to the undersurface of the foot, and it attaches at the base of the medial cuneiform and the first metatarsal. Then you can actually see, just peeking through, it's deep to, I'll show you the extensor digitorum first. So the extensor digitorum longus muscle also comes off the tibia, and it runs down, and its tendons actually attach to the distal phalanx of each of the digits 2 through 5. So obviously it extends the toe, but because it crosses the ankle, it can also help with ankle dorsiflexion. The extensor hallucis is deep. It's actually sort of, in this model, there's no point, if I take this off, it's still just attached to the back of the extensor digitorum, but it's the extensor hallucis, and you do see its tendon running down here to the big toe. And remember, the hallux is your big toe. You may have heard of people with hallux valgus, where their big toe is angled in, but in this case, this is the extensor hallucis longus tendon attaching to the distal phalanx of the first toe, and so it extends your big toe and again can also help with dorsiflexion. Now, if we just turn the model so that we're looking laterally, except that this is the left leg in the picture and your lab manual is the right leg, but you can see very similar structures as to this view. One thing to note here is you can see the Achilles tendon come down, you can see the gap here, so that when you go up on your toes and the calcaneus comes up against the back of the tibia, that's why you have that gap, to allow enough room for that to happen. So the muscles that we see here, this is the Peroneus Longus, which attaches to the styloid process of the 5th metatarsal. So it is here, that's the Peroneus brevis muscle. Peroneus Longus originates higher up on the fibula, and it comes down and it dives onto the undersurface of the foot, and it actually crosses over, and it attaches the medial side of the base of the medial cuneiform and first metatarsal. There's some small intrinsic foot muscles, just like in the hand. I don't ask you to know them for the purposes of this course, but it's nice to know there is an abductor digiti minimi and an abductor hallucis, just as you've got similar structures in the hand muscles. So now we're looking at the posterior view of the calf. We see the Achilles tendon, which attaches to the calcaneus, and we know that we have both the lateral gastrocnemius and the medial gastrocnemius, which come together into that tendon, along with the soleus muscle. Now we know the gastroc flexes the knee, but they also, because it crosses the ankle, the gastroc and soleus help to plantar flex the ankle. If I take away the medial gastrocnemius, and then you can see the soleus muscle sitting underneath here, it's shaped like a solefish or a flat fish. Now, an important thing, remember we learned popliteus muscle up with the knee. We also have posterior structures that are actually going to be involved in actually creating plantar flexion or toe flexion. So the Flexor Hallucis longus actually starts laterally but dives very medial. It attaches to the base of the undersurface of the first metatarsal. Then we actually have the tibialis posterior, which runs down, dives under the medial malleolus, and it attaches to almost all your tarsals, the navicular, cuneiforms, cuboid, and even the base of the 2nd to 4th metatarsals. And tibialis posterior is involved in plantar flexion and inversion. So it works with tib ant to create inversion, but while tib ant's a dorsiflexor, tib post, or tibialis posterior, is a plantar flexor. Finally, we have the Flexor Digitorum longus, which actually runs down, it dives under the medial malleolus, it runs to the distal phalanges of digits 2 through 5, and it is the primary flexor of your toes, digits 2 to 5, but because it crosses the ankle joint on the flexor side, it can also assist with plantar flexion. So this is the deep